Questions. Number 1. The flow of oxygen to be delivered through nasal cannula for a COPD client is A. 2 liters per minute, B. 4 liters per minute, C. 5 liters per minute, D. 15 liters per minute. Right answer is A. 2 liters per minute. Question 2. What is the purpose of humidifying oxygen during the oxygen therapy? A. To help thinning the mucus, B. To help thickening the mucus, C. To easily absorbed, D. To prevent pathogen entry. Right answer is A. To help thinning the mucus. Question 3. What is the color of the oxygen pipeline? A. White, B. Black, C. Yellow, D. Blue. Right answer is A. White. Question 4. What is the percentage of oxygen in the air? A. 16%, B. 20%, C. 21%, D. 78%. Right answer is C. 21%. Question 5. How many minutes does it take the brain to be damaged from a lack of oxygen? A. 2 minutes, B. 4 minutes, C. 5 minutes, D. 8 minutes. Right answer is B. 4 minutes. Question 6. Which of the following tissues are most sensible to hypoxia? A. Brain, heart, lungs, liver, B. Brain, heart, lungs, spleen, C. Brain, heart, lungs, stomach, D. Brain, heart, lungs, eyes. Right answer is A. Brain, heart, lungs, liver. Question 7. A nasal cannula is a classification of which types of oxygen delivery system? A. Low flow, B. Medium flow, C. High flow, D. Standard flow. Right answer is A. Low flow. Question 8. HFNO device flow rate is A. 2 to 5 liters per minute, B. 5 to 8 liters per minute, C. 10 to 15 liters per minute, D. 50 to 60 liters per minute. Right answer is D. 50 to 60 liters per minute. Question 9. When you found a fire breakout in a ward, what should be your next step? A. Activate the alarm, B. Rescue the client, C. Turn off the oxygen, D. Use of extinguisher. Right answer is B. Rescue the client. Question 10. A client is returned to the nursing unit after thoracic surgery with chest tubes in place. During the first few hours post-operatively, what type of drainage should the nurse expect? A. Serous, B. Bloody sanguineous, C. Serosanguinous, D. Bloody with frequent small clots. Right answer is B. Bloody sanguineous. Question 11. During the first 36 hours after the insertion of chest tubes, when assessing the function of a 3-chamber closed chest drainage system, the nurse identifies that the water in the underwater seal tube is not fluctuating. What initial action should the nurse take? A. Take the client's vital signs, B. Inform the healthcare provider, C. Turn the client to the unaffected side, D. Check the tube to ensure that it is not kinked. Right answer is D. Check the tube to ensure that it is not kinked. Question 12. A client has chest tubes attached to a chest tube drainage system. What should the nurse do when caring for this client? A. Clamp the chest tubes when suctioning. B. Change the dressing daily using aseptic technique. C. Palpate the surrounding area for crepitus. D. Empty the drainage chamber at the end of the shift. Right answer is B. Change the dressing daily using aseptic technique. Question 14. An oropharyngeal airway should be inserted A. At an angle of 90 degrees, B. Upside down and then rotated 180 degrees, C. With the concave portion touching the posterior pharynx, D. With the convex portion facing upwards. Right answer is B. Upside down and then rotated 180 degrees. Question 15. Clinical indicators for emergency endotracheal intubation include A. Airway obstruction, B. Respiratory arrest, C. Respiratory insufficiency, D. All of the above. Right answer is D. All of the above. Question 16. Nursing management of a patient with an endotracheal tube includes A. Ensuring oxygen administration with high humidity, B. Repositioning the patient every 2 hours, C. Suctioning the oropharynx as needed, D. All of the above. Right answer is D. All of the above. Question 17. The water seal used in a disposable chest drainage system is effective if the water seal chamber is filled to the level of A. 0.5 cm H2O, B. 1 cm H2O, C. 1.5 cm H2O, D. 2 cm H2O. Right answer is D. 2 cm H2O. Question 18. When caring for a client with a chest tube and water seal drainage system, the nurse should A. Verify that the air vent on the water seal drainage system is capped when the suction is off. B. Strip the chest tubes at least every 4 hours if excessive bleeding occurs. C. Ensure that the chest tube is clamped when moving the client out of the bed. D. Make sure that the drainage apparatus is always below the client's chest level. Right answer is D. Make sure that the drainage apparatus is always below the client's chest level. Question 19. A client has a chest tube attached to a water seal drainage system and the nurse notes that the fluid in the chest tube and in the water seal column has stopped fluctuating. The nurse should determine that A. The lung has fully expanded, B. The lung has collapsed, C. The chest tube is in the pleural space, D. The mediastinal space has decreased. Right answer is A. The lung has fully expanded. Question 21. A client who underwent a lobectomy and has a water seal chest drainage system is breathing with a little more effort and at a faster rate than an hour ago. The client's pulse rate is also increased. The nurse should A. Check the tubing to ensure that the client is not lying on it or kinking it. B. Increase the suction. C. Lower the drainage bottles 2 to 3 feet below the level of the client's chest. D. Ensure that the chest tube has 2 clamps on it to prevent air leaks. Right answer is A. Check the tubing to ensure that the client is not lying on it or kinking it.